Good afternoon, my friends. The doctor is in the house. Welcome back to another episode of To Your Health with Dr. G. On this great Wednesday, I'm broadcasting here live in Intellectual Radio Studios and on Facebook Live. We welcome you back to the show. I'm so excited today because today I got two of my really good friends here, Dr. Drew Spencer and Dr. Matthew McCoyd, and you guys will meet them in a bit. But really, today, we're going to have fun, but we're going to be serious at the same time. We're going to talk about a topic that's important to all of us. What we're talking about today, concussions, the latest in prevention, diagnosis, and treatment. Again, my name is Dr. Mark Gomez. I'm a board-certified internal medicine physician out of Edward Hospital in Naperville and Bolingbrook, Illinois. You can check me on my website at www.drmarkgomez.com. My handles on social media are at To Your Health, Dr. G. Again, we're broadcasting here on Facebook Live as well as in Intellectual Radio Studios. This is going to be a great talk because concussions at the end of the day, it's such an important topic for all of us. And as a primary care physician, certainly we see people that come in with head injuries. We certainly refer to our specialty colleagues when we see certain injuries. But this is a common thing that happens. So before we get to meet our guests, what we're going to do today is we're going to just kind of lay the playing field. We're going to talk a little sports too because of the concussions situation that we see in sports in Hollywood and things like that. But really, I want to lay the groundwork, lay the foundation, because at the end of the day, what we're talking about on the show is we're talking about building trust and delivering truth. And I want you guys out there to remember that, because that's one of the reasons why I started the show. I want to use my network of medical expertise. Use me out there. Navigating your health can be complicated. It can be hard. It can be scary at times. And so when we created the show, we wanted to make sure that people get the right answers from the right people, and then they go on and talk with their doctors about ways to live healthy, fulfilling, and active lives. So today's topic, we're going to be talking about concussions, which is a very important thing, but let me hit you with a quick disclaimer before we get into some of the meat and potatoes of this all. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So this topic today, concussions, is important, and today I've got two of my good friends here, Dr. Matthew McCoyd and Dr. Drew Spencer, who are experts on the matter. You guys are going to meet them in a bit. But I want to lay down a little more of the foundation. So concussion. And concussion is really a traumatic brain injury. And we're going to kind of frame this conversation around the context of traumatic brain injuries. But we'll get into the nitty-gritty of concussions because it's there's so much more of a public awareness on this condition. But traumatic brain injury, concussions, characterized by the head and brain moving rapidly back and forth, striking inside of the skull. And really, when you look at some of the statistics out there, the major cause of death and disability in the U.S. is actually traumatic brain injury. It represents 30% of all injury deaths, and approximately 153 people in the U.S. die each day from injuries that include traumatic brain injury. When we think about survivors of that, if somebody has a form of traumatic brain injury, and again, we're going to frame it about concussions, which is the most common in a sort of milder form, but when you think about people that survive concussions or traumatic brain injury, the effects can last days or sometimes it can be permanent, and it can have context and implications on their families and their communities. So concussion is the most common form of traumatic brain injury, and we're going to break this down a little bit more. So what I want to do is I want to welcome my panel to the show today. Each week, again, I invite a group of medical experts on, and we talk about a topic to get people the right information. So you out there that's listening and watching, I want you guys to really understand what we're talking about today, because you can be a weekend warrior, you can be a busy parent. This theme of concussions may actually cross your pathway and cross into your life. So what I want to do is I want to introduce my first guest today, Dr. Matthew McCoyd. And Dr. McCoyd and I go back to our days at Loyola Medical School, Loyola University Medical School, Strict School of Medicine. We were in the same class, actually. So the year 2000, graduated in 2004. But I'm going to let Dr. McCoyd tell you more about his bio in a second. Dr. McCoyd is a board-certified neurologist. He's also the associate professor and residency program director of neurology at Loyola Medicine. Check him out at www.loyolamedicine.org. Dr. McCoyd, welcome to the show.
Thank you for having me. It's great.
Please tell us a little bit more about yourself. I already let the cat out of the bag on the Loyola thing, but please let us know about where you did your training and all that kind of stuff.
Yeah, so again, my name is Matthew McCoyd. I grew up here locally. I grew up down the street in Elmhurst, not far from the recording studios here. I did my medical school training at Loyola Medical Center, as you mentioned. I did my residency and fellowship at the University of Chicago. And I went back to Loyola and started practice there back in 2009, going right back to our medical school, which has been a great experience.
Excellent. All right, my next guest, I'm so glad to have you guys here. This is awesome. And so my next guest, I met him a few years ago when he came on staff out at Edward Hospital, Edward Elmer's Health. And he and I connected really quickly, and partly because he's seen a ton of my patients, but he's an excellent clinician and an expert on this topic. So when I was coming up with this idea of the show to talk about concussions, I knew I had to have both Dr. McCoyd, who you just met, but also my good friend Dr. Drew Spencer on the show. So Dr. Spencer, welcome to the show. Dr. Spencer is a board-eligible neurosurgeon with Edward Elmer's Healthcare. Check him out at www.eehealth.org. Dr. Spencer, welcome to the show.
Mark, thank you for having me.
Please tell us about your
I'm an Illinois native
background.
myself. I grew up a little farther south up here, the small town of Marseilles, Illinois, and then I went to SIU for medical school, trained at both Loyola and Northwestern, and then I ended up out at Edward with you. And unfortunately, concussion is a big part of my practice with people with any number of traumatic injuries, from the most severe to the most trivial. Anybody that has any blood in their head, unfortunately, comes across me at some point.
Thank you. I mean, again, both of you guys are on the show. So here's how we work the show. For those that are new to the show, as I invite my guests on, and those that have seen the show before, we talk about what's called the chief complaint, aka the question of the hour. And what I'm going to do is we're going to set the framework for the discussion, and then really have our experts weigh in on their opinions. And again, we want people to get some practical information from today's show to therefore talk with their healthcare practitioners and see how they can continue to minimize risk for head injury and do as much as they can from a preventative standpoint going on in their lives. So the question of the hour, aka the chief complaint, what are we doing to increase concussion awareness, prevention, diagnosis, and treatment in 2018 when compared to the past? So I want to ask Dr. McCoy the first question. First and foremost, why don't we just talk a little bit about some of the stats, other stats about concussion? Who's at risk?
Yeah, so probably the biggest group of people at risk are anyone who's going to be involved in activities that could cause injuries either to the head or a force transmitted through the body to the head. So who I think we all probably the most worried about as both physicians and parents and just folks working in the community. It's mostly younger folks, right? So the biggest group of athletes that we think about are mostly high school players. And then we can think about kids at the collegiate level, and then that very small group at the various high level of sport, like in the NFL, who are kind of statistically almost an anomaly, though very important. So who's the biggest risk? I think a lot of people are at risk, particularly anyone involved in sporting activities, not necessarily just contact sports, but are probably our biggest at-risk group.
What about, Dr. McCoy, let me ask you a follow-up question. What about the elderly? Is there any risk that you see from older individuals versus the teenage or children population that you're seeing?
Yeah, so I think as we think about concussion, my concern with the older population would just be straight-up fall risks, right? So individuals who have fallen and had some sort of head injury or body injury that could increase their risk.
Thank you for clarifying that. And I think some of the stats on that one that I've seen, falls, this is based off of CDC data, 2013 published, well, it was published recently, but it's based on 2013 data. When they talk about falls, they believe that 47% of all traumatic brain injury related ER visits, hospitalizations, and deaths can be attributed to falling. And certainly when you're seeing it in the elderly population, as you said, just straight up falls, they have 79% of those individuals and adults age 65 receive a very high risk, and certainly as you're mentioning, the younger population getting risk as well too. Dr. Spencer, is there any kind of like particular symptoms that somebody may present with when you're thinking about possibility of concussion or other forms of traumatic brain injury?
I think the symptoms are really a varied bag, Mark. The common thread is a fall or some sort of trauma. It is the unifying thing. Most people have a headache. They may have other symptoms ranging from nausea or vomiting or visual complaints are the most common ones that I think we both see after concussions.
So what about, let me ask you a follow-up question. What, we're talking about obviously the context of falls, but other things too, motor vehicle accidents, self-harm, to be honest, as other risks that are out there. What's your guys' take on that? I'll ask you that question, Dr. Spencer. What are the reasons for people to have concussions, other risks?
abuse, I think, is something we have to think about too.
Okay.
As-
Yeah. Well, I think, when it comes down to like the awareness of things, again, certainly we're more publicly aware of things in 2018 than we were at any point. I think we can all safely say that because of sports, as you're mentioning, and because, as I mentioned in my opening comments about Hollywood, making this topic much more in the public eye. How do we go about, and again, I want to maybe ask this question to Dr. McCoyd, say we're at the high school level, we're seeing a lot of these things happening. How do you go about just starting basic education at the school level?
Yeah. So, for me, one of the big things with concussion today, 2018, if we go back to when we were in med school, which was now a million years ago.
Seems like it.
Yeah, right? We didn't talk about concussion. There was very little discussion about it. The idea was that, well, if you got your bell rung, if you were okay within a couple minutes, you could go back out in the field and play. And we didn't think a great deal about it. And then for a lot of reasons that we'll maybe talk about later, this has become something much more in the forefront of our concerns about, well, does this cause immediate or long-term neurologic effects? And I don't think we have the answers to these yet, which is maybe even more challenging. I think probably the biggest message we need to deliver is sort of twofold at all levels, which are concussions are a serious injury that can really affect anybody. It can have some sort of short and immediate term effects. I think we also need to deliver a message that we're not sure what the long-term effects of a concussion are at this point. We need more information, we need more studies. There's been a lot of speculation and some great science already, but letting athletes know that if you've had a concussion, that doesn't necessarily mean there's a late life neurologic problem. So I think it's twofold. I think we need education about concussion in the moment is a serious medical condition that needs to be taken seriously based on how the individual presents. And long-term, we just need more information about what are, if any, long-term effects of concussion.
I want to continue with this theme about sports-related stuff, and I'll ask this question to Dr. Spencer. Certainly there's a lot of pressure. When you're playing sports competitively, yes, you want to win. And there's certainly more pressure for a physician as yourself to clear somebody who may have been concussed. It seems like the public perception is that, oh my gosh, this guy needs to get back on the playing field. How do you kind of really judge between when it's truly safe versus maybe facing any potential external influences that says, hey, get this person, get this kid, get this professional back on the field as soon as possible? How do you kind of balance that out? How do you know when you're doing, obviously you're doing the right thing as a professional, as a physician, but how do you deal with some of those maybe external influences that may or may not be there?
Well, today I think we're more empowered to do that. I think, like Matt mentioned, the history of this is that everybody thought you got your bell rung. As long as you can still walk, you can go back in the game and contribute. But I think now, with all the awareness of the long-term ramifications of this, we've been empowered that the coaches, the medical staff, anybody on that sideline, it's their responsibility to know the long-term risks and apply that to somebody who maybe isn't thinking about that, certainly in the moment, or you see this a lot in young individuals who they just want to play a game. It might be that you go back to high school kids, this might be their last game. The last thing they want to hear is they're out for any period of time. But I think it's our responsibility to stand up for those people.
Excellent. Let me ask you another kind of similar question, same with this theme of sports. Certainly at the time of a concussion, say it's in a competitive event, we certainly as clinicians, we rely on a lot of our athletic trainers that are walking the sidelines, whether it's football or soccer, they're walking the sidelines. Sometimes a physician presence isn't necessarily there right there in that moment. How do you kind of work with educating the athletic trainers? How do you kind of keep awareness from other allied health professionals that are there? I'll ask that question to Dr. Spencer.
How do we propagate that information and get that to the other levels? I think there's a growing campaign, starting from the NFL down. They've been the biggest proponents of it, and equipping people with the questionnaires and the methods to evaluate people to know when it's appropriate for them to go back and when it's appropriate for them to be out. And I think that the more we focus on this and just educate the people who are leading these young people is the answer to that, and making sure we get the right people out of the game.
Dr. McCoyd, certainly at the professional level, there's a lot of resources there because of obviously the heightened attention. But what about, like, we're talking about communities that may not have those resources? How do we start to even have that kind of conversation?
Yeah, so your average concussion is going to likely be in a high school game or grade school game, if you're talking about just sports. I think something the Illinois High School Sports Association, the IHSA, has done is, and I think nationally, a campaign of when in doubt, sit them out. As parents, as coaches, as just sort of spectators, if you think someone has had a concussion, the most important thing to do is pull them out. There is no game that can be played at any level that's worth a potential injury. So, again, getting back to this idea that, knee injuries, we understand. The guy can't walk, we understand he can't play.
Can't play.
brain injury, the guy's walking around, he looks okay, so it's really tempting to say, well, you should go back in. If there's any concern, really the athlete needs to get pulled out and needs to get evaluated by somebody who knows how to do that evaluation. And a lot of places that person may not be present on the sideline. Certain levels you will have it, but the most important thing is get the athlete to safety.
So in the 2015 movie Concussions, starring Will Smith, that movie debuted, and it really focused on a lot of the work of forensic pathologist and neuropathologist Dr. Bennett Omalu, who really put concussion on a very big social awareness, public awareness forefront. And he basically published the findings of a condition called chronic traumatic encephalopathy, CTE, in American football players. And he published it in 2005 in his journal, in the Journal of Neurology, and he called for further study of the disease. So, and he was doing obviously the report was on a deceased NFL player named Mike Webster, who Dr. Omalu was studying the brain. So that was 2005 when that paper was published, but he actually did the studies in 2002, I believe, on Mike Webster on the brain slides. But have we really moved the needle, do you think, Dr. McCoyd? Have we moved the needle in just even the last 10 years, 15 years of saying, hey, we are really moving it, or do we still have more work to do?
I think we have I think the answer is yes to both. There's been a lot more information now about this than there was 10, 15 years ago. We are nowhere near where we need to be. I think there's been some recognition that head injuries can cause neurologic problems for a long time. The original papers going back to the 1920s and 1930s looking at boxers, that was published looking at things like dementia pugilistica, boxers who were punch drunk. We've seen data that head injuries potentially cause neurologic problems. There's been speculation about a lot of different disorders that can occur. These findings that have become really popular in the last few years are new. They add a lot to the current literature. What we would like to see is the findings that have been seen in these athletes, are they causative? Are the pathology changes you see something that do cause a late life neurologic problem? Or are they incidental, that they are there but they're not causing some of the symptoms? We would love a little bit more data on that. We don't have a lot of normals. Most of the individuals who've been studied had symptoms. That's why their brains were donated. So we are not there yet in terms of having a full understanding of the long-term implications, if any, of these head injuries.
So we're talking about, obviously, from the sports perspective, and I think, obviously, as a parent myself, and I've got a 4-year-old son and a 7-year-old girl, and they're active in sports, and as a physician, it does kind of cross my mind and say, you know, maybe I'm kind of the helicopter parent that just wants to be there all the time, but, you know, I want them to be able to participate in sports because they like playing sports and it's fun. You know, a lot of parents have some reservations on getting their children involved in contact sports because of the heightened awareness. Dr. Spencer, how do you really kind of educate the parents? How do you, you know, you have conversations with your patients, but how do you educate the parents on what signs to look for? Or even, how do you kind of give them reassurance that, hey, you know, as long as we're prepared, you can play that sport where we'll be okay? How do you kind of have those kind of conversations?
Mark, I think that's one of the most difficult conversations to tell them, because no, I can't in good faith go out and tell them that they'll be fine, go out and play football, do whatever you want, or go out and play soccer. There's a big thing now coming out about even girls soccer where they're taking a lot of head injuries. So no sport is totally safe, but I think the best way you can do that as a parent is for you to be involved, for you to ask your kids about the game, to just watch their behavior, to know if there's changes. If you have concerns, you have to be willing to speak up.
So there was a statement put out by the American Academy of Pediatrics where they basically said if there was anything more than like a light tap on the head, and I'm paraphrasing a little bit, but anything more than kind of a light bump to the head, if there's anything more than that child should be seen by their pediatrician or a pediatric neurologist or somebody sooner than later. But the backside is that sometimes kids have difficulty expressing themselves. So I'll ask this question to Dr. McCoyd. Are there any other kind of signs that kids may present with? Because they're not really able to express themselves too much. What are parents need to be looking out for?
Sure, I think as a parent and as a physician, is a child doing anything different than normal for them? Do you know what happened? Was there an injury? Did they fall? If so, can you get any information about what the event was? I think for the parent, is your child acting differently than normal? Your child doesn't normally complain of headaches, they don't normally complain of blurred vision, they don't normally complain about being sick to their stomach, where they're acting much differently. Kids are gonna fall. It's gonna happen, right? Kids are gonna get injured all the time. Well, I think all of us have young kids.
Kids fall.
That's a reality. You, I think, have to make a decision every single time about, well, is there a serious injury? Certainly as physicians, I think we're probably a little more comfortable than the average parent with what we're looking at. But to me, the big thing is, what happened and how is the child acting? If they're not acting right, yeah, I think the index of suspicion should be high and they should get checked out. Kids acting perfectly fine, you have to make a decision as a parent.
There's the same kind of role, obviously, with adults, obviously being able to talk a little bit more openly about it. But do you still have that same kind of heightened awareness as a clinician when you're talking about adults that may have had a head injury? For example, a lot of my patients, where I'm at, a lot of my patients love playing hockey, adult hockey leagues. And I see guys come in, they're bruised up the next day, my first question is, wow, you guys must have been skating pretty rough at, usually they're skating at like midnight. But you never know, it can hit, but how do you kind of get more of a heightened awareness, and I'll ask this question back to you, Dr. McCoyd, how do you get more of a heightened awareness in the adult population of head injuries?
Yeah, one, simply recognition head injuries are probably a problem. Two, again, what symptoms is the individual having? Some things that I certainly have seen in my practice and I think is in the literature are some of the things that Dr. Spencer had already mentioned with, have you developed headaches that weren't there before? Are you having problems with concentration? One of the biggest things I've seen in my practice with adults in either sports or non-sports related injuries, they have a hard time at work. They have a hard time with concentration. Their ability to maintain attention and focus is just not right. And again, the challenge there is you're in front of your employer, you look fine, you're acting fine, you're walking fine, talking fine, but there's clearly there's not something right. So I think just being aware that, I was doing something and I'm not myself currently is enough to at least have a discussion.
Dr. Spencer, is there any kind of time frame that you're looking at for of patients, adults, for example, that come in, maybe they have some lingering symptoms for a few days? When does that adult try to say, hey, I need to get this checked out? Do you have any kind of threshold that you're looking at on as far as symptoms? And because obviously, when I think about the context of traumatic brain injury, what if it's not a concussion? What if there's a subdural hematoma? What if something else is going on? So what kind of framework? I mean, what kind of a time frame are we working with for the general cases of head injury?
That's going to be a little bit of a case-by-case basis, to be honest with you, Mark, but I think anybody that has symptoms like that go past 24 hours or approach that 24-hour mark, if you don't feel like yourself and if you're altered, having trouble getting through your normal activities, I think that's probably time to be evaluated by your professional.
Would you recommend, Dr. Spencer, follow-up question, would you recommend that individual be seen maybe in the emergency room, or is it reasonable to be seen by the primary care doctor, or is it really just kind of more like case-by-case?
I think, again, that involves some judgment. I think if you feel almost like yourself and you can get through most activities, but you're more fatigued, or you have a headache to do it, you have difficulty focusing, it's probably okay to start off with your primary care doctor at that point. But certainly, if you feel like there's a big problem, the ER is always the safest way to go.
And I would agree, and then certainly from even a testing perspective, a lot of times one of the first tests after a thorough neurological exam and getting an appropriate history and physical, a lot of times it's very easy to just get a plain CT scan. How commonly, Dr. Spencer, are you seeing CT scans used for traumatic brain injuries in the form of concussion versus like more dangerous traumatic brain injuries? Are you seeing CT scans used a lot for just basic concussions?
So we live in a very scan-happy world now. So yes, I do see a lot of CT scans, and it's most of the, especially the more mild concussions in younger people, they tend not to have any significant findings on CT scans, but they may be very symptomatic for a long time. In the older population, they're more susceptible to having positive CT scans with bleeds. And a lot of people do get CT scans because of, I think, our exams are flawed, quite frankly. There's a lot of individual tests that you may be able to pass even with a bad concussion, but now some of the newer studies have come out that you need to combine some of those things, make people really focus on doing two things at once, and that makes our tests a little more sensitive.
I like that with the multitasking of people. Dr. McCoyd, when you're in the clinic, or even if you get called on a case in the emergency room, what are some of the first things you're looking for when you're seeing a patient present with a suspected traumatic brain injury?
So, my sequence, one, what was the story? And then two, just trying to go down a list of how serious of a problem do I think this person has. You mentioned the neurologic exam. Is there anything in the history or particularly in their examination that starts to localize? And I can say, hey, as a neurologist, I think there's a focal brain problem. They've got weakness in the face, arm, or leg. They're having difficulty with language production. There's some abnormalities when we look in their eyeballs, there's abnormalities in terms of the size of the pupils. Where I go from this is a clinic visit where we're going to talk about, you getting back to work in a couple days, to you need to be in the emergency room, you need to be scanned, we have a big emergency on our hands. So for me, it's the checklist of how serious of an injury do we think this is? Is this something that needs emergent management right now that's potentially life-threatening? Or is this something that is unfortunate, but we can handle this with outpatient management?
Do you think, Dr. McCoyd, that I guess what I'm trying to get at is like, if we as physicians, and I think actually a lot of this comes back to even us as physicians, and me as a primary care doctor, I know I'm trying to stay current on a lot of different things, and I need to have I feel like I even need to have a more heightened awareness on traumatic brain injury and concussions. The challenge sometimes is getting access, and sometimes people don't want to go to an emergency room because there's going to be a big giant copay, or it's much more cost effective to go to a step down facility like an immediate care or even your primary care office. But how do you kind of like navigate that? Because sometimes the thing that would make me feel really guilty is if I had a patient, they saw me in the office, but they knew they should have probably gone to the ER, and they had a significant bleed, for example, Dr. Spencer, a significant bleed on a CT scan, but maybe they said, I didn't want to go there because I didn't want to pay thousands of dollars because I have a high deductible plan, and so I'm just going to go to my primary care office, and I can't get my treatment or get diagnosed as fast. How do you kind of break down those barriers, Dr. McCoy?
So a number of centers have done this. I don't want to shamelessly plug for any one specific one. We have tried to create concussion clinics in a number of places, and your goal with a concussion clinic is to get someone to be seen by a certified either profession or certified trainer within about 24 to 48 hours of their symptoms to try to make a decision. Number one, is this a concussion or something more serious? And then based on that decision, well, what, if any, testing is now necessary? I know for a number of the local high schools, we're trying to get athletes in within 24 hours. And there's a bunch of reasons for that. We want access to care for those who may have had a concussion or brain injury, so they report their symptoms. My own experience in clinic is that young men playing high school football will not report their symptoms because they're aware that potentially gets you out of today's game, it may get you out of next week's game, you may lose a third or half of your season, so they're unlikely to report. Our hope is that if they know they can get in to see a physician quickly and we can help them, that they're more likely to let us know if they're having an issue.
I like how you're really talking about just a way to attack this problem, because we know that people that statistically concussions are out there, and as you mentioned at the beginning of the show, you're seeing a high amount of that teenage population statistically, and to have that kind of resource is actually reassuring for people out there that are listening to us to know that, hey, we can get you seen as soon as we can in the specified matter with professionals that have been highly trained in that regard. So that's actually a really good thing. The reality, of course, is not everybody has those kind of facilities and those resources at their fingertips, and I wish we can. What do you think, well, I'll ask this question to Dr. Spencer, what do you think needs to be done? I mean, is it more like different medical offices should collaborate on something like this or form their own thing? I think about hospitals that are maybe in smaller towns, or facilities that are in underserved areas in underserved sides of a city. How do we get those same kind of resources there that Dr. McCoyd is describing now?
I think that's a great question, and I don't have a good answer for you, Mark. I mean, it's easy in areas that are more urban and you have the resources, or you at least have the population and the awareness, but I think you're exactly right. The biggest at-risk populations are some of the more rural areas where they don't necessarily have the resources or just the manpower to staff clinics like that, but I think the more we can set a protocol so everybody has this available to you, I think you'll see increased reporting, better outcomes, and safer care to the younger people.
Are we ever seeing, and I'll throw this question out to both of you guys, are we ever seeing any use of more technology? Say the resources aren't there, and I think like telemedicine or things like that, where you might be in a big city at a major medical center, but you're able to have conversations in real time with physicians that are in smaller facilities. Are you guys seeing any of that? Is anybody doing that kind of stuff right now in relation to concussions and how to manage things?
Not that I know of.
So for concussion, no. I do think that in general, one of the things I'm talking to my residents about, my medical students about, is really to anticipate telemedicine becoming very much part of their futures.
Yeah.
If I were to go back and start all over again, a consistent message I give our guys is you can reach out to the community through electronic means. Obviously, Surgery, different story, got to be hands-on with the patient. For a lot of things in neurology, we actually do think that telemedicine can be really helpful. Right now, in a number of communities, we have telestroke, where there's actually ambulances equipped with CT scanners to deliver information from the ambulance directly to the hospital. Obviously, there's limitations. That's expensive. Literally, does the road system support the ambulance because of the weight? But I increasingly think we can reach much farther distances through telemedicine to provide some consultation. Will it ever be practical real time for concussion? You know, that there's a lot of games being played on Saturday mornings. That's going to be pretty challenging. But I do increasingly think we can see that kind of technology coming into part of overall healthcare.
And I kind of envision, you know, an iPad or something like that, and you might be in your office, or Dr. Spencer might be in his office, and you have an instant, they might be, an athletic trainer might be on the field with somebody, and you're instructing that athletic trainer to go through a few different moves in real time, and you can kind of implement a treatment strategy right away. So that'd be great, but I think going back to telemedicine, and I tell people on the show, I like to geek out sometimes. I like the tech. We try to incorporate new tech on different topics that we've discussed so far. So I think that's a win-win. We're actually trying to do that in primary care now, just to have more electronic type interfaces and interactions with our patients. And I certainly, when you think about concussion, I think about like parents that have their kids maybe at home. They can actually be able to talk with their physician, or train nurse practitioner, or train athletic trainer via technology, and can engage, for example, when that person may be able to go back to work or school. So speaking of going back to work or school, I want to ask this question. I'll ask Dr. Spencer this question. Generally speaking, after being diagnosed with a concussion, for a student, when is it safe for them to go back to school? Is there like a general rule of thumb or things that you're looking for as a clinician to tell them when they can go back to school?
So my general rule of thumb is they have to have a significant decrease in symptoms. I think with some of these kids, they have very prolonged symptoms, and for them to expect them to rest until they're asymptomatic, that's not always realistic, and quite frankly, that's not in their best interest. I think some of the newer studies that have looked at rehab and how we get people better, it's actually detrimental for them to go on total rest. When their symptoms have decreased, when they're able to get through a normal day, do some of their normal activities, and not be completely fatigued just with their initial taking care of themselves, I think that's when it's time to push them and at least start out with at least some of the time going back to their normal activities and going back to school. With that, I think you're going to have a handful of kids that do bounce back, that don't tolerate it the first few days, but I think it's a fine balance between when it's too early and letting them have too much rest.
The rule of thumb that I remember from going through my days, and again, I agree, Dr. McCoyd, when we were at Loyola as medical students, we didn't really talk about this hardly at all. And now, again, I just love to see that we've grown as a society to embrace a topic like this and have just more create more public awareness. But I was kind of thinking as an intern, I'm going to say, all right, you need to rest. And I say, I don't want you really doing much of anything, just to rest. Hard for some people to do, of course, think I'm like a busy professional and I'm seeing adults. But when can somebody like get engaged in maybe using their brain? And I could maybe go back to Dr. Spencer as you're describing, you know, what are you looking for in kids? When can they read a book again? When can they engage in like brain activity? I'll ask that question to Dr. McCoyd.
Yeah, so one, we don't have a perfect answer. Two, the pendulum has really swung heavily on this. Again, you have the American Academy of Neurology, my academy, in the late 1990s. We put out a position statement about concussion. If you had a concussion, less than 15 minutes of symptoms, you didn't lose consciousness, you could return to the field of play that day. Then with particularly FIFA and some European agencies, they put out guidelines in about 2012 where one completely in the other direction. Absolutely no activity whatsoever until you're asymptomatic. Dr. Spencer mentioned, well, the problem with that becomes that can be a long time. Similar to in the past, we said, well, if you have a back injury, just stay in bed for a long time.
Yeah, we used to say that a lot.
It turns out it makes it last longer. So trying to find that balance is really challenging. The other reality is we could take 100 people, give them all the same hit, and you're going to get 100 different outcomes. So it has to be individualized. For me, when I'm talking to either athletes or adults, I want them to try to rest. I want them, while they're symptomatic, for the first maybe 24, 48 hours. I want them to get back into some activity. So light walking, light exercise. I think reading is fine. I really ask them to try to minimize electronics. So try to minimize television with fast-moving objects, try to minimize screen time, which is probably a good idea in general, until they are progressing through and getting to the point where they can do activities without symptoms.
No video games then for our teenagers that are playing Halo and all this kind of stuff?
So, I thought about this and thought, well, am I giving good advice? My feeling was, I'm probably giving good advice, period, saying don't play video games. So particularly a symptomatic athlete or adult, me telling them, listen, put down the TV and the video games for 48 hours, I'm probably doing them a favor anyway. And I think there's some
When was
reason
the
to
last
think-
time they did that? That's what I said.
Correct. Particularly if they're still symptomatic, I think that's the right thing to do.
Okay. I'm gonna ask this question for Dr. Spencer. So we're talking a minute ago about a little bit more of the kind of the recovery, what to expect, and when can people integrate themselves back into their daily routines. Dr. Spencer, from your perspective, when is it safe to drive a car again after somebody's been concussed?
There's no guideline for that, Mark. There's no set answer for that. I think you should be, especially in a severe concussion, you should be evaluated by a professional. There are certain signs that are really important for us to figure out. If you have any problems with visual spatial processing, or you have any certainly eye movement abnormalities, that's not going to be safe for you to process information and drive. Everybody recovers at a little different rate. Some people never have that from the get-go with a concussion. Some people have it 2 days later. So I think at the very minimum, it requires evaluation by at least your primary care, by a specialist. Someone needs to evaluate you and do a full neurological exam before you should get behind the wheel of a car.
When we think about our athletes again, and this is interesting, I love that we're talking about this because this is just practical stuff. People gotta work, people gotta go to school, people play sports, and we're trying to make sure that people are safe at the end of the day. And that's the kind of vibe I'm getting from you guys. We want people to be safe and exercise correct judgment. On the flip side, we know, again, some of those, as I was mentioning earlier, about some of those external pressures that may be there to say, hey, you got to compete, or as Dr. McCoyd saying, the high school kid who might be in his last couple of games of his football season, the senior year, he's not going to say anything. What does that set you up for? Because let me ask you this, Dr. McCoyd, what if somebody who clearly had a concussion gets concussed again?
Yeah, so again, we don't know, and I think we're there's this discussion about second impact syndrome, which we could probably get into. We don't know. It does look like potentially there's a window where if you've had one concussion, there may be a window where you're at a higher risk for a second concussion or third concussion. And will that eventually cause either immediate, intermediate, or long-term neurologic issues? And I don't think we're sure. I certainly think if someone's had a concussion, they've shown that they have the propensity to be concussed. And we want to try to reduce that risk as much as possible.
What are some other, let me ask Dr. Spencer, what are some other complications of somebody that is concussion, a severe concussion? I mean, obviously you think about the prolonged symptoms, whether the visual spatial symptoms, mobility type symptoms. You mentioned like focus, Dr. McCoy mentioned that earlier, concentration. But what are some dangers that are out there? I mean, the risk, we're trying to create some urgency on this topic, and again, I think the public and the public stratosphere, we've created some urgency, but like, what are the real dangers out there if somebody maybe mistakes a concussion from another severe traumatic brain injury? What's the danger at the end of the day? I mean, what are people at risk for?
I think people are at risk for missing a serious injury, and I shouldn't say missing a serious injury. Concussion is a serious injury, so anytime you have those symptoms, we know it has long-term implications. But if you don't take it seriously, if you don't get evaluated, if you don't have that sensitivity to it, I think you can miss a life-threatening condition, which is unfortunately what we see too often.
Mm-hmm. I think about the impact of multiple injuries, sustained injuries. Going back earlier about the studies with Dr. Amalu, the cumulative effects of these multiple injuries, that's real. And the reality is that sometimes we just still put ourselves in that situation. Not us, because none of us sitting here on this panel, anybody that's watching, we're not athletes. We're athletes in our dreams, in our sleeping, when we're sleeping at night, or when we're daydreaming in between patients, when we're going to see the next patient in the room, maybe we're athletes and all that kind of stuff. Or to our kids, we're definitely super dads. But we're not athletes at this table. But the reality is that people can still put themselves in that situation. So let me kind of frame the question a little bit. What are we doing to prevent this from happening? I'll ask Dr. McCoy, what are some steps that we can take to prevent concussions or any form of head injury from happening?
So I think it's going to depend on the context, right? Sports versus non-sports. For sports, I think a lot is in simply the existing rules as well as some of the technology. There's a really fascinating study from maybe 10 years ago where the Department of Defense is really interested in this. We talk a lot about the NFL and sports. The Department of Defense is extremely interested in concussion because they're putting the military personnel is at high risk with blast injuries. So there was a study looking at a mouse model. They put mice in a blast chamber, and when the mouse was blasted, they could create pathologic findings similar to what we see with CTE, where they could see very specific changes in the brain. If that mouse's head was fixed, I imagine they probably stapled the head to do that, and the mouse was blasted, so the head didn't rotate, there was no pathologic changes. So there's some thought that, well, the technology itself could probably get to a point where you can start reducing concussion. If you watch NFL football or college football, you've seen those changes in the helmet technology. Probably the biggest thing we can do, though, at least at the sports level, is just enforce our existing rules. In the sport of football, the death rate was pretty consistent from the early 1900s to about 1974. And in 1974, they banned spearing. Everyone who's played football has seen it. There's this sticker on the back of your helmet. Right when you put your helmet on, the last thing you see is a warning, this is not to be used as a weapon. You're not supposed to strike people with your helmet. So at all levels, if there's coaches who are, what can I do to reduce my kid's risk of injury? Well, make sure they're tackling appropriately. Don't lead with the helmet. Let's try to minimize head hits. We mentioned soccer, right? Football's getting a lot of the attention. Football's our sport here in America. Well, how many times when somebody's practicing headers in their, during the week prior to a game, how many consecutive hits to the head are there with corner kicks, for example? So I think trying to improve the technology is one thing, and two, trying to minimize head contact that's unnecessary are two big steps we can do.
I think about some other things when we think about our kids, protecting your kids as well too. I mean, you mentioned you hit the head on the nail with the technology and the design of equipment and safety. I just think of like just general thing, kids fall, as you were saying earlier, hey, parents out there, have your gates up if you're got steers. There's so many things you can do around the house. Make sure your kids wear a seatbelt. We talk about motor vehicle accidents as a reason for head injuries. Make sure people wear seatbelts, and the seatbelt usage rate, I would assume that it's better than it was back in the day, but I actually don't know, because I feel like every time I'm driving, I'm seeing people that don't see, that are not wearing seatbelts. But I think about other things like just general wellness. I mean, I tell people, just stay active, exercise, and that's just more of a kind of a cop-out, kind of preventive strategy. But I say just keeping the body moving. We want people to live healthy lives, and to keep the body moving in a healthy way. Hopefully that minimizes injury as well too. Dr. Spencer, any other kind of techniques that are out there to prevent head injuries that you're seeing or that you're advising your patients?
Not specifically, Mark.
Okay.
I just tell them, especially if they've had a head injury, you need to avoid certain things. Like I actually see, oddly enough, in the middle-aged men population, even older than that, martial arts are a big thing. And I've had to tell multiple people, that's not okay for right now. You have to, even the simplest things that are part of your daily routine. You don't realize the just minimal head trauma that can add up over time, especially when you've had a major injury.
Go ahead, Matt.
I would just jump in looking at there are other ways to reduce concussion risk. There's a number of things that are advertised and available that will reduce your risk of concussion if you're playing sports. We don't have any data on any of this stuff. None of it is FDA approved. I'll occasionally have somebody come into the office and say, I found something that I can buy that reduces the risk of concussion. There's no good data on that. The best way to reduce the risk of concussion is to avoid head injuries. So it's all the stuff we talked about. Be aware of the sports you're playing. Wear your seatbelt. Wear your bike helmet. Use the equipment appropriately.
No. Well, hopefully as we do that, we can start moving the number. Again, we know that statistically people are likely to get things. And we all understand accidents happen, falls and things like that. But as we're trying to be more aware of everything that we're doing, then hopefully we're driving down the burden that it can take. I want to ask one more question before we get into myths versus facts. I'll ask this for Dr. Spencer. Dr. Spencer, there's a concept known as post-concussion syndrome. Can you explain that a little bit for us?
Post-concussion syndrome can mean a lot of different things, and it's a general constellation of symptoms. I think that Dr. McCoyd probably sees a lot as well. And you can have people that have headaches, they have difficulty focusing, they have persistent nausea, dizziness, visual complaints. It's any number of those combined that persist for longer than what you would expect. Most people can feel better from a concussion in a few days. Anybody that has it longer than that, we generally lump them into the post-concussive syndrome diagnosis.
Thank you. And I see that quite a bit from a primary care perspective. I'll see people come in, I'll say, your story, it sounds like you had a concussion, or they might have been actually seen in the ER. They come back and see me 2 days later. They were diagnosed with concussion, and they may still have some lingering symptoms, and we usually give us some information to support on post-concussion syndrome. I actually try to make sure that all my patients that are diagnosed with concussion, whether it's diagnosed from the ER and they're sent home, and they come see me, I actually make sure that they see a neurologist. And I think it just kind of covers all angles on things to just make sure that we have the highest level of treatment and awareness and education given to those patients. So what I want to do now, I want to go into a section called Myths versus Facts. And this is something I started a few months ago in the show. And really, when we're talking about navigating your health and making sure that people have the right resources and the right information for just living healthy, the reality is that there's still a lot of blatant falsehoods and misleading information out there. So again, one of the reasons why we kind of got into this and creating this show is we wanted to dispel some myths. So I'm going to come up with I'm going to ask my panelists some questions that I kind of gathered myself over the years from just people telling me some stories anecdotally, and I look at them and I might say, I don't know what you're saying there. That sounds like a big old myth. But also I got some information from some reputable resources through the CDC, and that is a reputable resource. And so I want to ask our panelists here, we got myths versus facts, concussion version. So what I'm going to do is I'm going to read a statement, and I'll ask the question. You either say myth or fact, and maybe one or two lines about why it is a myth or a fact. Here we go. Myth versus facts, concussion style, everyone. All right. Dr. McCoyd, first statement for you. Excuse me. A player who has been knocked unconscious will suffer a worse concussion than a player who didn't lose consciousness.
Myth. The level of consciousness doesn't determine concussion. Again, you can take 100 people, hit them the same way, different outcomes. So loss of consciousness is not an underpinning for concussion, though it can represent it.
All right. Next question here, or next statement, I shouldn't say question. Next statement, Dr. Spencer. A normal CT scan rules out a concussion. What's your take on that?
Absolute myth.
All right. Please explain a little bit.
I would guess there are multiple people in the ER per day that I never get called about because they have a normal CT scan and they absolutely probably had a concussion.
Fair enough. All right. Next statement, myths versus facts. Dr. McCoyd. Helmets prevent concussions.
I'm going to go, can I go fact and myth?
I guess you can.
I think helmets are really critical for safety. They do protect the brain from even more serious forms of traumatic brain injury. But helmets can also cause concussion if they're used inappropriately. A helmet used as a weapon can really cause a big injury to an athlete. So it's a little bit of both.
All right. Dr. Spencer, here we go. Concussions are the same for adults and adolescents. Myth or fact?
Myth.
Very well.
The pathology, the injuries might be the same, but they have very different brains. I know that a lot of the pediatricians like to rally behind that they're not just little adults when they talk about kids or certainly adolescents. They have a lot of things going on developmentally. They tolerate some of these changes very differently from adults.
I think, by the way, I think some of our listeners and viewers are onto our secret here. It's not really myths versus facts, it's really myths versus myths. I think everything I'm saying to you guys is a myth, but that's what we're here to set the record straight. So here we go, myths versus facts. We gave them the answers already. All right, here we go. Dr. McCoy, dilated pupils are a sign of concussion.
We're going to go myth, obviously, but if we do see dilated concussions, that's a big concern we have. Why is there a change in the pupils? Does this actually represent a more serious form of brain injury?
Excellent. Dr. Spencer, myth versus fact. A person with a concussion must be taken to the emergency room.
Myth.
Please explain.
It's really up to the medical staff on site to make that initial judgment, and it goes back to a lot of things we talked about before. A person with a concussion who's awake can pass most of the neurological testing, starts to feel better even within an hour of the injury, is probably okay for observation, but somebody that starts to develop pupillary changes, localizing signs like motor weakness, those people need to be evaluated right away. People that clearly have an altered level of consciousness as well.
All right. Myth versus fact, Dr. McCoy. Physical activity should not be allowed following a concussion. Maybe that's actually more. Maybe I'm telling the truth on this one.
Yeah, I think it depends. I think we should limit activities following concussion, but at some point we need to get people back in a graded fashion. So activities can depend on the individual, but I do think within a couple days we want to get people mobilized and get it moving.
Okay, a couple more of these. Dr. Spencer, pain medication should never be given after a concussion. What's your take on that?
I say myth on this. Doing what I do, we see a lot of people with other complex intracranial pathology, people after craniotomies, and there's two schools of thought on this. Never give narcotic or strong medications to these people because it can cloud your judgment, your assessment. But I think if you see a true neurological change in someone, they are going to display that change or be able to wake up through the pain medication. So you need to rely on those localizing signs, and those will tell you whether they have a more serious problem. The pain medication shouldn't be used to cloud your judgment.
All right. myth versus fact, I'm gonna ask this one to myself. Concussions should, why not? I should get involved in this game too. It's my show, right? Concussions should be treated and managed on an individual basis. I say, well, when we talk about our patients just in general, everything should be tailored to the patient themselves. So their management plan will be individualized based on their history and physical and their presentation. So I'm gonna say fact on that one. All right, next one for Dr. McCoyd. I think you kind of answered this one, and this might actually be a fact too, but here we go. Children who have suffered a concussion should avoid all screens and digital media. I think you answered that.
Yeah, my preference is in the immediate period, yes. Let's try to decrease inputs and hope that it can speed recovery. I think we should probably decreasing screen time in general. So right after the incident, I would say, listen, let's try to take it easy.
All right, and I'll leave this last myth versus facts for Dr. Spencer. Here we go, save the best for last. Concussion patients should be awakened every few hours so they don't lose consciousness. What's your take on that?
I think that's a myth, but it requires some judgment. I think if the initial evaluation is that they have a mild concussion, they're awake, they're alert, they're not displaying any of the signs that we went over previously, I think the rest is a big part of this as well, getting your normal rest. If they have any of those more worrisome signs, you probably shouldn't let them go to bed in the first place. You should be going in to be evaluated.
Certainly, yeah. I always tell people this, there's no crying wolf when it comes to medicine and healthcare. I'd feel more comfortable myself rather telling somebody and giving them reassurance on something versus somebody maybe potentially delaying access to treatment or delaying treatment in general that can lead to some catastrophic effects. So I say, hey, if there's something going on, it doesn't seem right, it doesn't seem right, I want people to go see their doctor immediately. There's no harm when we're talking about concussions. Dr. McCoyd and Dr. Spencer both said, going to the emergency room because you're going to get the treatment right away and the diagnosis right away. So we got about 5 minutes left, guys. So what I want to kind of do is kind of wrap this up. We've been talking all aspects of concussions, the presentation, the symptoms, approaches when it comes to like what can we do better as far as clinicians ourselves, what can we do better as educating others, our athletic trainers, our coaches, our parents, our communities, the school levels, the educators and everything. So I want to kind of wrap this up because it's been a great conversation. So what I want to do, at the beginning of the show we talked about something called the chief complaint on why, or question of the hour, which we've been talking about thoroughly. And now when we wrap it up, we're going to call this the assessment and plan. And for those that are new to out here to the show, really the assessment plan, when somebody comes into your office, that's when you kind of wrap it up and you kind of give them their diagnosis and their treatment strategy. So the assessment and plan, concussion style, what I'm going to ask our panelists to do is just give us 3 or so take-home points regarding concussions. Just kind of your final thoughts on this matter. I'll begin with Dr. Spencer. What's important for people out there to take away from this theme that we've been discussing of concussions?
I think overall awareness, Mark, and just being cognizant of the long-term effects of it. And I think there's growing data now of things that are available for you. We talked about how to outreach. There's certainly things that are available now to make sure that you have adequate information for evaluating people. The SCAD-5, the Maddox questionnaire, just basic things that anybody with a concussion, no matter their age or other circumstances, wouldn't be able to pass. And I would say, like we talked about today, looking for those localizing signs from a practitioner standpoint, knowing when it's a more serious problem, they need to be evaluated. And then just being diligent about follow-up. Some people, after their initial evaluation, will have the tendency to just go deal with this on their own, and you really need guidance as far as the right thing for you. Exercise, when to return to your normal activities.
Dr. McCoyd, take-home points?
Yeah, so all the things we just mentioned about the acute management of concussion and awareness of its entity and the need to take care of it in the immediate standpoint. My other take-home point is that we don't know the long-term effects. Chronic traumatic encephalopathy is a big concern right now. We're still very much in our infancy in terms of understanding it. One of the challenges I think we all face as professionals and parents is we are trying to forecast where that science is going to go in 10, 20, 30, 40 years. But we need to make decisions right now. Are we going to let our kids play sports? Are they okay doing contact? And that has to be an individualized decision with risk and benefit. So for me, from a professional standpoint, I'm fascinated where the science is going to take us, but I just wish we could get there faster.
Excellent, thank you. For me, my kind of final thoughts are this. We're talking about an important topic that can impact any of us. Our families, our kids, our loved ones, even accidents. You could be at home doing a house project and you fall off a ladder and you hit your head. So really it's all about just being aware of your surroundings. That's a message that can certainly be clear, certainly be told to our patients out there, our adults, but we have to even have better discussions with our kids. Obviously we want the best for our kids and for our teenagers that are growing up and playing sports and everything, but we want to do it safely. And even for those that are out there that are adults, we want everything to be as safe as possible. So I cannot underscore the importance of knowing your surroundings, education, and of course, establishing a good relationship with your primary care doctor. And remember, if something goes bad, it's your primary care doctor that's going to really get you through the thick and thin. They can help direct you to specialists like Dr. Spencer or Dr. McCoyd or some of their colleagues in their fields of neurology and neurosurgery. They can direct you to the emergency room or your pediatrician. For those parents that are out there, talk with your pediatrician. There's so many ways that we can educate each other and educate the community at large and make sure that everybody has the equal resources to do well in combating concussions. So that being said, I want to thank my guests today, Dr. Drew Spencer, board eligible neurosurgeon, Edward Elmers Healthcare. Check him out at www.eehealth.org. My good friend, Dr. Matthew McCoyd, I invited him on the show. We went to Loyola together. We were talking a little bit about Loyola, alma mater, basketball is great. Dr. Matthew McCoyd, board certified neurologist, associate professor, and residency program director, neurology at Loyola Medicine. Check him out at www.loyolamedicine.org. You guys know me. Next week on the show, we're going to be tackling a great topic. The title will be #NotFakeNews. Vaccines save lives. You've been listening to me here, Dr. G, To Your Health with Dr. G, live here on Intellectual Radio Studios. Check me out on my website at www.drmarkgomez.com. See you guys next week. Peace out.